Hi, Osana. Thank you so much for meeting with us today. Are you able to tell us a little bit about yourself and the organization that you lead?
Sure. So my name is Osana Tosunyan. I currently oversee the Care Extender program at UCLA Health. My counterpart isn't here. Her name is Silva Thomas. She is the director overseeing the program. I'm the manager overseeing the program. We tag team both hospitals that are a part of UCLA Health, which would be Ronald Reagan as well as Santa Monica. So we offer students an opportunity to get hands-on clinical experience in a hospital setting, and that's predominantly what the Care Extender program is about. And I'm happy to dive a little bit deeper in terms of some of the requirements, qualifications, those types of things. So excited to be here.
Awesome. Thank you so much. So, my first question for you is, what does being a care extender typically look like?
Sure. So to be a care extender, we offer students, like I mentioned, the opportunity to shift in a clinical setting. A typical day, I would say, would be usually a week. I'd like to highlight it in a week-long process. So care extenders are really in the hospital setting once a week for about 4 hours. Within their first rotation, the first 3 months of them being in the program, they actually have to do what's called a greeter's position as well as a main department shift. So the greeter's position really allows care extenders to get an understanding or at least build soft skills by communicating with patients, visitors, checking them in, supporting them with wayfinding. And then also they have an opportunity to shift in a clinical setting. So we have various different departments, close to about 30 departments or so across both hospitals that allow students to get that experience. Some of the things that care extenders are able to do, they're able to discharge patients after they've received care at the facility. They have an opportunity to round, address the 4 Ps, which are it's questions or information that you look for in patients to make sure that their care is being held at the highest standard. They do also have the opportunity to work alongside our nursing staff, support our care partners, and then also build relationships with the physicians in the hospital. A lot of our care extenders really value the experience because they have the opportunity to build relationships with people in the facility or at least in the health system. And some of them actually get hired throughout their time in the program. So that's really exciting to see as well. So hopefully that kind of answers the question.
Yeah, for sure. Awesome. All right. The next question I have for you is, what makes care extenders different from the other pre-health volunteering organizations on campus?
So I can't really speak in terms of other volunteer organizations on campus. I'm not really familiar with the campus organizations. I know that we do work alongside some organizations that do a lot of philanthropic work, and they also get some kind of experience in the health setting. But I think what really puts or sets us apart is health that care extenders are actually part of the care team. So our nursing staff, our care partners really look to our care extenders to be that extension of the care team. That's kind of the reason why we call them care extenders. They extend that care to our patients. It also puts the program aside from everyone else because of the fact that we do have a vigorous onboarding or at least entrance process when it comes to identifying students from their application to their interviews. And then we provide them with the training. I don't think, or at least I'm not really familiar with any other volunteer organizations that are on campus or even within, other hospitals that really provide the same level of training that we do. In order for care extenders to actually begin shifting, they go through a full day of training, and that starts at 8 a.m. and it ends around 5 p.m. And then every rotation, they're required to attend in-person department training so that they're fully aware of what they need to do, where they need to go during their shifts. So we cover various topics in healthcare that include, reporting, mandatory reporting, HIPAA, any other compliance presentations that we have. We also have bloodborne pathogen training. We go over CI care, which is our method of communication within the hospital. We do also provide our care extenders with training around infection prevention, and then also some other topics that we cover just so that they are understanding of what their role would be in the healthcare field, and also for them to really understand what their role as a care extender is when they start their shifts.
Awesome. Thank you so much. So the next question I have for you is, what is one impactful personal experience you've either had within this organization or you've seen?
Sure. So it's really interesting that you asked this question because, every single day we kind of see how impactful the care extenders are to the organization. One of the biggest impacts that the program really has to UCLA Health is really enhancing the patient experience. The Care Extender program is underneath the Volunteer Services Department, but is really overseen by the Office of Patient Experience. So that really shows the level of impact that our students make in the day-to-day care that patients receive. Some students say, oh, I was rounding on a patient and a patient thanked me for the work that I was doing, whether it was checking in on them, getting their nurse, small little details that students are able to support with really go a long way. There is a correlation to having an extra set of hands in a clinical area during a very, you know, distinct time of need, that when you have extra people on deck to really support with the plan of care of a patient, your satisfaction rates in a hospital tend to increase in a positive way. And that's what we've seen in the past. One of the main examples that I'd like to use is our greeters, for example. In any other organization, if you go to other hospitals, you don't really see volunteers in the frontline areas that are really supporting with wayfinding, which means helping patients and family members get to where they need to be, or actually helping them check in visitors. One of the biggest initiatives that we've been performing over the last few months recently is a new scope that we've added to the greeters role, where care extenders are supporting with checking in visitors, managing the lines. Post COVID, there were a lot of requirements that have been asked from UCLA Health for us to manage our visitor policy, and our care extenders have been positively impacting that area. If you see, care extenders kind of walking patients to and from where they need to be, you start to notice that the visitors and the patients feel comfortable actually coming into the hospital setting and knowing that there's going to be someone there that's going to take them where they need to go.
Awesome. Sounds good. And then my next question for you is, what can students take away from volunteering with care extenders?
Oh my gosh, I feel like that's like a loaded question, because there's so many things that students can really take away from. I think one of the um, biggest categories, or at least one specific skill that they could really take away from this program, is truly how to speak to patients. I can't tell you how many times I've worked with, physicians or physician assistants over the years that have always said that who they wish that they had an experience in a clinical setting before they went into the field of healthcare, because when you actually go into your first year of medical school or PA school, you do live simulations with patients, where you introduce yourself, you ask the patient how they're doing, and that initial communication with the patient is very daunting for someone who's never really had that experience. And in the Care Extender program, you get really comfortable speaking to patients. You get comfortable being part of the integral team, working alongside nurses, learning how the flow and the operations of a department works. You also get a chance to understand an organization and what works really well in an organization, and what some of the areas are improvement what areas they can actually improve on. From my experience and asking some of my past care extenders who are now alumni that are in, medical school, that have been, that are actually now physicians, some of them are physicians. They've all said that the experience that they've gained in the Care Extender program, not just in the clinical setting, but also should they have gotten into our leadership team, has really prepared them for their career path, because they learn, soft skills, they learn technical skills, they learn how to work as a team. They get a chance to understand what it really means to network and to build long-lasting relationships, professional relationships, and have just had a wonderful experience. That also doesn't mean that, everyone that goes into the Care Extender program ends up going into the field of medicine. We've had several situations or several cases where people come in thinking that, they want to be a cardiac thoracic surgeon, and they're so excited to be this physician. And then they've never had any clinical experience before. And then the first time they step foot into the clinical setting or into a department, they immediately realize that that area, or at least that experience, isn't what they've imagined in their mind. And it's not really something that they're really passionate about. And I think for administrators like myself and my counterpart Silva, like, those things are, having that type of realization is also positive, because you don't waste your time for 8 to 10 years in a field that you're really not excited about. So I think those are also wins where, one positive takeaway is all of these amazing things that students can gain from it. But then another positive in our perspective is that you realize that the field of medicine is probably not a fit for you, or at least the clinical side of medicine is not a fit for you. And those are, things that you can always take away from in a program like this.
Awesome. Sounds great. And my last question for you, which you kind of touched on a little bit before, but in terms of the application process for care extenders,
Mhm.
when are applications due and what does that process sort of look like? And then what distinguishes strong applicants for care extenders?
Sure. So we host orientation 4 times a year, so practically every quarter. We try to align our dates with the UCLA calendar academic system. So we bring in applicants 4 times a year, and we host an orientation session where we kind of talk about the program, what the requirements are, what eligibility looks like, what they could really take away from the program, if this is really a right fit, what the commitment looks like, and that all of that is covered under orientation. And then once those that attend orientation, they'll receive a link to our application, and the application is only open for a short period of time. So whoever attends orientation will receive an application link. What then we'll do is we'll provide them with a certain number of hours for them to complete their application. And then we have a hard deadline stop. So any applications submitted online after that deadline, we do not accept. from that point on, what we do is we go over the application, we grade it. Part of the application, it could be very lengthy because we always ask for emergency contacts, those general requirements for an app. But predominantly the application consists of anywhere between 3 to 5 questions. Close average is about 4 questions. Essay prompts that we really look to understand holistically what an applicant looks like. It's always nice to see, you know, extremely high GPAs, all of that good stuff, but we really want to understand the person and what kind of impact they want to make in the field of healthcare. So the questions are really tailored to pulling information from an applicant that we wouldn't be able to see on a resume, for example. And then once their application is graded, we determine, you know, based on the mean score of all the apps submitted, what percentage, you know, the top 10%, top 15%, whatever that percentage is, it varies from rotation to rotation, who we're going to be inviting in for interviews. Then we'll bring them in for interviews. The interview process is similar to that of what most medical schools do, which is a multi-mini interview type, where they go through various different stations. We ask them one question, they have a certain period of time to answer it, and then we grade them based off of their responses. We deliberate as a group, we take a look at all of the scores and then determine the final count of people that we'll be accepting. Once interviews are over and we accept those number of students, we then invite them in for training. They all have to attend, whoever is invited must need to attend training in order for them to actually become active care extenders in the program. They go through the training process. I think I covered in terms of what the curriculum looks like generally. And then after the training is completed, the following week after training is typically when they start scheduling them, or they schedule themselves for their shifts, and then a week later they actually start on the floors.
Great. Thank you so much, Osana. And before we leave, is there anything else that you'd like to add?
I think I did not answer the second part of the question, which is how do we, you know, what determines really a strong applicant? Because the application is really focused on the 4 essay prompts, between 3 to 5 essay prompts. Typically it's an average about 4 or so. Those 4 essay questions are extremely important. We look at, you know, grammar, spelling, syntax, all of those things. We really truly want to see how serious somebody takes these application questions and answers them. I can't tell you how many times, you know, it hasn't been a lot, but over the last few rotations due to COVID, you know, it seems like some students haven't been taking things seriously. And we've seen, you know, 1 to 2 sentence responses, which in the past has never been the case. So we truly want to see the amount of effort that's been put into these applications and the thought and energy to really see if that's truly what they want to do and be a part of in the program. We don't want this to be another checklist item on their list of things that they need to do so that they're accepted into medical school or into their medical field of choice. So I think that's kind of what we look at in terms of candidates. It's really hard to pinpoint because if you ask, you know, a medical school board, what do you guys look for in a candidate? They can't really pinpoint and tell you exactly what they're looking for and what criteria it is. We just want to see who's really coming in, being themselves, and really looking for it to be a right fit for them, and whether or not it's something that they're going to be passionate about and committed to.
Awesome. Well, thank you so much, Osana. That was super comprehensive and very helpful, and we really appreciate your time.
Thank you so much.